Please check out the attachments pod right to the right of the PowerPoint. You'll see that the PowerPoint slides from today can be downloaded. This presentation was made possible by the Preschool Development Grant Birth through 5 initiative from the Office of Child Care, Administration for Children and Families, U.S. Department of Health and Human Services, and the U.S. Department of Education. We're excited to welcome our experts from AEM and the state today, and without further ado, I'm just going to turn this over for a couple words of wisdom from Jim Lesko.
Thank you, Evelyn. Well, welcome everyone that is on the phone today. And so today we are concluding our 4-part series on integrated data with the Preschool Development Grant Birth to 5 project. We have had 3 previous communities of conversation, one on data governance, a second one on data privacy, and a third conversation around the use of a single ID. So today we're bringing all that information together to address the issue of what an integrated data system can and would look like. I'm happy to be able to introduce Bill Hennikins and Tony Ruggiero. Bill and Tony hail from the AEM Corporation and a part of their data team. They were a part of an earlier webinar. Tony was a part of an earlier webinar process, and Bill is joining the group today. We want to remind everybody that the invited participants, some of you may have heard earlier, include all of the PDG B-5 grantees. And we always encourage the grantees to include their partners and consultants that they may have involved in their projects. On the line today as well are all of the PDG B-5 TA team members. Likely have many of the federal project officers and regional office staff also listening in, as well as some of our other PDG B-5 TA partners. Specifically the State Capacity Building Center and their colleagues, also a part of the Office of Child Care Technical Assistance System. Participation in today's communities of conversation are always voluntary, though we hope as many states agree or find it worthwhile to participate. We will have some select presentations and resources made available. There is an open discussion and dialogue. The lines are muted for the time being. If you do have questions that surface during this conversation today, we do encourage you to put them into the chat, and we'll make sure that the presenters are aware of those questions, and we'll do our best to get to those questions during the conversation today. We will specifically focus on the Early Childhood Integrated Data System, ECIDS conversation. That will be an overview. We'll have participant questions and discussion. We have 3 states that we are so fortunate to have volunteered to be a part of the conversation, that they will join us later in the presentation. We'll look at a series of best practices, and then we'll have some concluding remarks. So I'm going to turn this back over to Bill and Tony to start the presentation. So take it away.
Great. Thank you very much, Jim, and thank you, everyone, for joining us today. So to kick us off, we have a question for you. What do you think of when you hear the term early childhood data integration? Please enter 1 or 2 words into the chat box that come to mind when you think of early childhood data integration. Oh, great. So we see folks entering into the chat, single ID and systems interfacing, time, coordinated systems, statewide data, ROI, return on investment. Wow. Complicated, difficult, streamlined, all great answers. And things we need to keep in mind as we plan, develop, and implement our integrated data system. Thank you. What is an ECIDS? It's an early childhood integrated data system that collects, integrates, maintains, stores, and reports information from early childhood programs across multiple agencies within a state that serve children and families from birth to age 8. Now, that birth to age 8, some states may elect to go with age 5. That is dependent upon the state and their stakeholders. And also another key word in here is report. So we're starting to think about, or we are thinking about, data use when we are building these systems. And we'll have a little more on that in a bit. Typically, the data included in an ECIDS are related to the individual child, the child's family, classroom, program, and/or providers, and other services that provide comprehensive care and education for young children and for our young students. I do want to mention before we move any further that integrated efforts take place not only in an ECIDS, but also states integrate their early childhood data into their state longitudinal data systems as well. And we'll also have a little more on that later, and you will hear different perspectives from our state guests today in terms of the systems that they're working with. Here we see a graph that shows the different domains, child, family, classroom, program, and workforce data that can contribute into an integrated early childhood system. Examples of programs that feed into this data system are public primary education, K-3, Head Start and Early Head Start, state pre-K, home visiting. So, for example, a program like Parents as Teachers. Part C, early intervention. Part B, Section 619, which is preschool special education, and child care. It could be public child care. And in contributing to this effort, this provides greater opportunities to ask more complex program and policy questions, whereas a single data set within a single office may not be able to address, and which helps us to ultimately use the data to make informed program and policy decisions. The broad purpose of an ECIDS, or an integrated early childhood effort, is to provide integrated cross-program data that inform decisions about early childhood policies, services, and education. The state's early childhood leadership team should define and drive the specific purposes, and we'll talk a little bit about that on the next slide with some program and policy questions. And this helps support the state goals and to meet the information needs of the intended users or stakeholders of this integrated effort. Here we see essential questions from the Early Childhood Data Collaborative, and they address the individual child level data that can be put into an integrated system. It also addresses characteristics associated with positive outcomes for children. It looks at program data. What is the cost of a high-quality program, for example? And then, as you can see, a couple workforce-related questions in here as well. This is a great place to start. When I was in Delaware, we used these as our foundation to look at our efforts within our state. And the nice thing about these questions is they're broad enough where when you share them with your stakeholders or your your counterparts in other agencies, that everybody can see these questions and identify how they're able to contribute to the integrated effort. As you can see, in talking about stakeholders, here are some examples of stakeholders who are not only intended data users, people who will use the data once the system is built, but also people who should be involved or engaged from the beginning, from planning to designing to implementing this integrated data system. So you can see we have policymakers, state agency leadership, early childhood leadership. Parents and families always key in everything we do in early childhood and in education. Our service providers can help us, for example, test our systems that we're building. Is the system providing the reports correctly, or the reports that were asked to be built? And then researchers, another great way to broaden the use of our data and to encourage people to use our data. So what we have here, so what is the difference between an ECIDS and an SLDS? So the primary difference between these two systems are the sectors that are included within each one. So an ECIDS brings together data from multiple early childhood programs and agencies. And SLDS brings together data from numerous sectors. So what we'll see in states with an SLDS is that it typically belongs to a P20W effort. Some states refer to them as P20 and some P20W plus. And essentially these systems are being built to look at data longitudinally from, and now they're actually looking at longitudinal data from birth all the way through early childhood, through educational experiences, all the way through the workforce. And in turn, an ECIDS is designed to answer questions focused on early childhood, as we just saw, and an SLDS is designed to answer questions that span more than one sector. In many states, these systems are being designed simultaneously, and so it is important for states to establish the distinct purpose of each system and to leverage the commonalities and share best practices and lessons learned. So they may be two different systems, but there's an opportunity or opportunities for folks working on an ECIDS to learn from those working on an SLDS and vice versa. Also, if an SLDS is already in existence and an ECIDS is being planned and being built, that it's important for that communication to exist too, for the potential to bring some of that data that's going into that early childhood integrated data system into that state longitudinal data system. And with that, I will turn it over to Bill Hennigan.
All right, Tony, thank you very much, and welcome everyone. Appreciate the opportunity to talk with you about ECIDS or ECIDS. So before diving into the next slide, I see we have two questions. First, from Cody, how can states move towards an ECIDS or ECIDS when shared definitions for eligibility, quality, et cetera, are not yet established? Well, moving towards those shared definitions would be part of doing ECIDS work. It's part of what that governance around definitions for elements, governance around business rules are all part of what you need to do. in this process and in this work. So they're kind of doing that is one and the same with doing ECIDS work. So I think that's maybe a good question that some of our panelists, our state folks, have maybe some experience doing that they could share with us. So we'll revisit that one. So next, what is a P20W? So P20W really just in the kind of the vernacular in the SLDS world, so the statewide longitudinal data system world, it really just means early learning to school age to post-secondary, so 20, like college, graduate school and so forth, and workforce. It's just data systems that are designed to, as Tony said, longitudinally to essentially pull data together and make it available for study analysis used to improve outcomes across that whole spectrum. So next I see is the infographic of the ECIDS, something that can be shared. I am sure that we can work with Jim and company to get that shared out. Okay, so let me go on then to the next slide. I don't want to go past that one too quickly. So data system design. So it's really a four-stage process. An ECIDS is a data system that integrates early childhood education, health, social service information from key participating state agencies. System design can take on many different meanings and definitions depending on how it is applied. For all ECIDS projects, system design is a component of a larger system lifecycle, and it can be a very complex IT process to design and translate a state's needs into a technical solution. This process often involves four stages that we'll talk about more in depth: assessment, design, development, and implementation of the data system. So with assessment stage, states first review their mission and vision and ensure that the goal of the ECIDS will be met with the system design. You don't want to design a system just to design it. You want to design it to meet your needs, your vision, your mission. From there, states should create a communication plan, establish business requirements, and then identify which requirements to prioritize. At this stage, states should also work on creating data sharing agreements amongst agencies that will contribute to data to the ECIDS. Well, this is considered one of the most challenging aspects of system design. It is a critical piece that will help various stakeholders understand what data is being shared and how that data can be used, what they're going to get out of it. So next in design, the second stage, and it is the most important technical stage. During the design phase, states determine the type of model they would like to implement for the integrated data system: federated, centralized, or hybrid approach. And we'll talk more about those in detail a little bit later. For many states, the choice of a model depends on the culture of the agency involved and the degree of comfort the state has with sharing data. Oftentimes, there could be regulations or laws that impact this as well. All three models will require business rules to determine how data are extracted and to what degree the data will be integrated. Depending on how the data will be matched and linked together, these business rules may cover processes for transforming data as they enter the ECIDS. While many data elements will be unique to their source system, there may be data elements, such as those with similar names but different code sets or definitions, that will need to be discussed and reconciled through data governance. So data governance, again, is something that is crucial to this process. During the design phase, states should also do the following: perform an inventory of current systems and the data that is available in these systems. As states are approached with policy questions, an inventory of current data will help them recognize if the right data are available to answer the questions or inform research projects. This inventory should also identify any restrictions on the use of that data. The Common Education Data Standards, or CEDS, is an excellent tool for doing this work and something that more technical assistance could be provided on. Heavily document every aspect from beginning to end of the process. Documentation will continue to be an important tool as the system design is developed. Next, use a reliable unique identifier and data matching process. The use of a UID or other identifiable matching data is the backbone of a state's integrated data system. Without reliable linkages, the resulting analysis will be difficult to use. Finally, describe desired features of the system and create system diagrams. Because an integrated data system is theoretical, states should create tangible items such as screenshots and handouts to help stakeholders understand the system, potential tables of data that you want to see. Get something concrete for stakeholders to look at and to use. So next we have development. At the development stage, states should adopt a development lifecycle process. Project management remains a crucial step at the development stage and will help ensure that states are bringing in the data components that will eventually be linked in ECIDS. During this stage, states will also begin to engage with vendors, issuing requests for proposals, and managing the work of vendors once they are brought on board with the project. Finally, we have implementation. What all the work has led up to, and if the work has been done diligently and has been done with care, this is where you start to see success. In the final stage of implementation, states should be ready to deliver the ECIDS to stakeholders and end users. At this level, the ECIDS should be stable and secure, and all measures need to have been taken to ensure confidentiality and compliance with federal, state, and local regulations. So an awful lot goes into it, but in terms of designing the system, if you look at it, kind of the assessment, design, development, and implement, you'll have a good high-level path. So let's dive into the models one more time, or a little more deeply, and the type of systems that you can design. So a centralized system. So once data in a centralized system is integrated, and that has occurred in a centralized system, the data linkages are loaded into a central database or warehouse so they can be used for multiple purposes, such as reports and extracts. And these linkages, this integration is remaining. It's stable. It's something that's going to be held over time in a centralized system. In a federated model, data sets are created from linked data, but the linkages do not persist after each use. The data linkages are generated upon every data request. An advantage of using a federated data model is that states do not need a central data warehouse for an integrated data system, though they may have, and oftentimes do, have more kind of repeated ongoing work to meet specific needs or requests for data. Now, as with all things, there's hybrids, or there are kind of systems in between. A hybrid data model combines aspects of the federated and centralized data models. The identifiable data that a state uses to generate linkages among records is maintained, but the records themselves are not necessarily linked. So, that's a little bit more in depth, but obviously you could go a lot more into it, and in collaboration with IT and technical folks, there's a lot more details of this, but hopefully that gives you an understanding of what we reference when we talk about a centralized, federated, or hybrid model for an ECIDS. So with that, I will turn it over to Tony, who I believe has another poll question.
Thank you, Bill. So as part of your early childhood data integration effort, is your data in an ECIDS or in a P20 plus SLDS? And please enter ECIDS, SLDS, or if you're just starting with your planning or still deciding, let us know. Or if you're absolutely unsure, you could say don't know. Wow, very good mix.
That's just what I was thinking, Tony, a good mix.
Yes, absolutely. We'll give another second.
Yeah, and a good number of folks are still in the planning phase, so hopefully the information is valuable.
Absolutely, along with good opportunities to learn from each other as well across states. All right, well, thank you everyone for participating on our poll, and I'm going to turn it back over to Bill, and we're going to have our discussion with our state guest.
All right. Thank you, Tony. So I would like to introduce Stephen with the Early Childhood Utah Health Program. He is the, I should say, Early Childhood Utah Health Program Coordinator with Utah Department of Health. Howard is the statewide coordinator with the Early Childhood Education Division at the Texas Education Agency. And Alejandra is the acting division director of Early Childhood Services at the Department of Children, Youth, and Families in New Mexico. So, folks, thank you very much for joining. And hopefully you've thought about that first question that we had from the audience, because that's where I would like to begin, since it's something they identified as a need. So could one of you or more of you speak to your experience with coming to shared definitions, things around something like eligibility or quality, those kinds of things, that governance process that needs to be gone through in the early stages of doing ECIDS work?
Well, good afternoon. This is Alejandra from New Mexico. And of course, our work started with Race to the Top. There was a lot of discussion between the three main agencies that oversee early childhood programs. And one of the pieces that we worked together was to define quality and identify essential elements of quality that can be addressed across different early childhood sectors, and agreeing upon some of the data elements that we wanted to collect. From there, we then went on to discuss some of the pieces on how to collect the data at the program level and how to start establishing some rules that we can all agree on. So that took us a few years. It didn't happen overnight. This has been work that we've been doing for the last 5 years, and we feel that we are at a place now that we have some definitions that have been agreed upon. But it does require a lot of discussion, a lot of compromising, and some things you have to have in place before you dive into how you're going to collect that data. And for us, the biggest challenge was to identify those essential qualities of element for an early childhood quality program.
Thank you. Thanks for sharing. I really like that you talk about that, that it took some time, that you went about it and established those rules, and having those discussions. You talked about it taking a lot of discussions. Is definitely my experience when I was doing this type of work in Washington State. And the more of those discussions you have, the more that you spend time getting on the same page, documenting that. Those rules and definitions and so forth, the better it is in the end, and you spend less time actually working with folks doing the coding and the actual IT work. So Howard, Stephen, anything else to add to that question?
Yeah, this is Howard speaking, and relating to our statewide longitudinal data system, or SLED application. So that we have Texas education data standards, and so this is a collection of data standards that are based on national EDFI, which have XML core floating into our database, into our TSDS. So that's our Texas student data system. And so from there, then that data is aligned with our PEIMS, which is a lot of our student level information and program organization level information, which then would populate any public reports. So we have our core education data standards, to ensure that we have that common, understanding of the terms and terminologies. As we build and are moving towards our ECIDS, we're looking at aligning those standards with other state agencies.
Excellent. Thank you very much. Okay, well, let's go to the next question then. And you really did address this some, Howard, but for the others, what data model does your state use? Is it an ECIDS or an SLDS? Is it centralized, federated, or a hybrid model? And why did you choose a certain model, and what were the benefits of using that particular model?
Hi, this is Steve Matherly from the Utah Department of Health. And let me just start off by saying we call our ECIDS ECIDS, so you'll hear me refer to it as ECIDS. And additionally, we're not a race to the top early learning challenge state, so it's taken us, we're in our 7th year of putting together our Matcher database as well as our ECIDS. Some funding from the Early Childhood Comprehensive Systems Grant, as well as some funding from the Child Care Development Block Grant from our colleagues here in Utah. And so our model is a centralized. We use a centralized system. As I mentioned, why? Well, back in around 2013, we had the Utah Department of Health had an opportunity to utilize Medicaid technology enhancement grants. And we also needed a Matcher database that would benefit our entire department and not just our ECIDS. So we spent some time exploring perhaps utilizing existing databases, but those were more operational in nature, and we really couldn't, at the time anyway, reconcile kind of our research needs with the existing databases that were more operational in nature. And plus, being at the Department of Health, we have the Vital Records Department, birth and death registries. So we really wanted to be able to utilize that data for matching purposes and identity resolution, as well as denominator, as well as using it for denominator data, for population type data. And advantages would be consistent data, being able to pull, be able to kind of hard code reports, and be able to have data once it's in there to be able to use it many different ways over a period of time. And I'll turn that over to the other speakers now.
Thank you very much. Alejandro, would you like to elaborate on your system? It's an ECIDS, an SLDS, centralized, federated, hybrid, kind of why one model over the other, and what are the benefits for you in your state for that model?
Absolutely. So, like Stephen said, we were a race to the top state, but it's taken us just that long even to come up with the model that we have right now. Our ECIDS model is considered, I think, we will consider it a hybrid. We have some centralized data that is housed within here, the Children, Youth, and Families Department that houses all of child care, pre-K, and home visiting data, all the workforce data, and all that information is housed here. However, in the other agencies, we have the Part C program, and we have the public education pre-K program, as well as the 619 information. So what we are doing right now is all that information is being fed into the centralized warehouse to provide the information and do all the matching of the data. However, we have external information that we couldn't have a centralized process because, of course, we don't have the oversight over those programs, and those programs that are starting to participate are more in the volunteer type of approach, and that is our Head Start data. We're still negotiating some of those partnerships to bring that data into the warehouse. So for us, bringing the information from different databases and agencies was critical to have the ability to do both, have an automatic fed into the warehouse, but also do an on-request data set that would allow us to have a more complete picture of our state information. and at the same time ensuring that there is no duplication of data that is being collected. The other part is that each one of the databases that are currently working within each one of those agencies it has a different purpose. Some of them are used for billing, some of them are used for accountability, and some of them are used for assessment. So because each one had a different function and they had a different setup, it was important for us to continue allowing those data systems to exist, but making mechanisms to ensure that that communication is taking place within the warehouse.
All right, thank you. That's interesting and helpful. So we've got two new questions from the chat from Brittany in New Hampshire. So the first is asking about your experience with state legislation on privacy, where it may be more constrictive than the federal legislation. If so, what steps did you take in order to move forward with data integration? So each of you could share, what the status is with state legislation or rules around privacy and what you did as a result of.
And this is Alejandra. I can share a little bit about how we are protecting the identity of our families. We do have some state regulation, perhaps not as strict as the ones that you have, but we actually send to the warehouse our information using the unique ID. I think you mentioned the unique ID being a critical point because that is actually how we de-identify data. We have memorandums of understanding within each agency that is sending their data set, ensuring that we do comply with our HIPAA and our FERPA. Depending on the program, we are actually bound by both. And we rely on those MOUs to ensure that our information is safeguarded and the privacy of our families is actually protected.
Great. So a linking ID or a research ID. That's helpful.
This is Howard here in Texas. Oh.
Yeah, go ahead, Howard, please.
I was just going to say that we implement a similar unique ID process as well. And every other either state agency or other government agency, we'd have a memorandum of understanding, a data sharing agreement that would be reviewed by our security officers to make sure we are aligned with any HIPAA or privacy issues, but also ensuring that we have data governance to kind of review those collection on the data being collected and how it's being used to ensure that there's that additional discussion that happens around the data collection and the data use of the data.
Thank you, Howard. Go ahead, please.
No, go ahead, Bill. It sounds like you have a follow-up question for Howard. Go ahead.
Yeah, I was just going to. So, Howard, do you have in Texas anything beyond FERPA, HIPAA, any unique state legislation or things around privacy that you have to address?
Not explicitly that I'm aware of. There are some local issues, but I think when we're just mostly looking at those FERPA and HIPAA guidelines, and then ensuring that we do our due diligence with our state agencies to ensure that we mitigate any concerns. I think over time, I think there's less concern than maybe we had at our state agency, more than 5 or 10 years ago.
Okay, good.
And then,
thank you.
And in Utah, we indeed do have privacy laws specific to our state, but they have not impeded our progress. They speak to the state education agency or the SEA being transparent, so parents have an opportunity to know how data is being shared, along with national, federal laws. We also have state laws that protect. They're really mainly focused on vendor products that end up in the classrooms and making sure that software products and hardware products, your tablets and your various learning softwares are not capturing PII, from students and then using that data inappropriately. That's mainly what our state laws speak to. If anything, we have had state laws over the last few years that have done a tremendous effort to facilitate the development of our SLDS as well as our ECIDS. I also see a question about, the initial steps where states started. And it's very much what was described earlier in bringing together the stakeholders, developing questions mutual questions that everybody would like, answers to, and then beginning to do a data inventory as to the very, we started with some very basic data elements here in Utah, just enough to be able to match identities amongst the various service providers, as well as some enrollment and exit dates, and now we're building towards additional data such as attendance or encounter, data, race, ethnicity data, things of that nature. But our first phase was, just enough to be able to match and be able to show distinct count of children and which programs they are enrolled in which order or sequence. But yeah, the steps that we, as well as taking that data inventory. And fortunately, my predecessor, Colleen Murphy, was very familiar with CEDS, SEDS, and it was spoken about earlier. And we have a data dictionary, and we've done alignment with their tools.
Thank you very much. Yeah, Colleen was great. We have done quite a bit of work with her related to CEDS things, and it is a good, valuable tool for doing that particular work. So with that, and that's really looking to address Brittany's second question, talk about steps that you can take at the beginning stage of data integration. So Howard, Alejandra, any further advice for Brittany on that?
Yes, I think that what I would add is one thing that we did early on, and I think somebody spoke about that, is doing the inventory of the data systems you want to integrate and the capacity of those data systems to integrate, what kind of data elements are being collected and why. And then a lot of discussion then to start agreeing upon which data elements you want to integrate, because not everything, as I spoke before, not everything can be integrated because it serves different purposes. But agreeing on certain data elements that you want to collect, what comes very closely with that is the kind of questions that you want to answer and what the purpose of your ECIDS is going to be. Is it going to be for policy decision making? Is it going to be prioritizing funding? Is it going to be for gap analysis? Is it going to be for moving your system forward, tracking children's progress, making programmatic issues? I mean, there is some definite ideas that came about on what we wanted to respond based on our stakeholders and our community needs. And from that, we actually had to reduce to a few questions. You're going to be very ambitious. You want to take over the world. But just know that you have to take one bite at a time and be very patient and very cordial and very understanding that what purpose this ECIDS is going to serve, because you're working with the cross-agency, cross-system. And in early childhood, we always say that we're very territorial. And when it comes to our data, we're even more territorial because we're very protective of our data, and rightly so. So again, I guess the first, if you want to do like a step-by-step, the first step will be to do the inventory so you know who's collecting what and what data systems are existing in your state.
Great, thank you. So with that, let's turn, we've talked a lot about the beginning, how we take care of privacy, security type things. Let's turn to output. of the system. So question for the panelists, does your system have reporting mechanism or interface to allow stakeholders and the public to access data to create their own reports? Does the system have canned reports for stakeholders and the public to use?
This is Steve from Utah. I can answer that question. And then I wanted to add to Brittany and what Alejandra said is when you're doing that inventory, you also have to discover how that data is regulated. We often speak of FERPA or HIPAA, but and actually it's nice when your data is covered by FERPA or HIPAA, because then you have a roadmap, you have a template, and you have some tangibles that you can go to learn about the exceptions and how to handle that data. Actually, what's a bit more challenging is when the data is not clearly regulated, by a specific body. Then you really have to do your research. You have to work with the funders, as in the case of here at the Department of Health, we have WIC and home visiting, as well as a ages and stages questionnaire, developmental health promotion program. We also work with Help Me Grow. So all of those are wonderful sources of data, but they don't fit squarely under FERPA or HIPAA. And in those instances, you have to do your research and work with your federal funders and your state legal team, and probably even make sure that you get parental consent upon during the enrollment process. With regards to reports and such, our ECIDS, as I mentioned, is housed at the Utah Department of Health. We have a data governance manual, a data governance body, and yeah, we have 4 hard-coded. I won't call them canned because they're very dynamic reports. You can adjust time frame, and you can get these reports down to a zip code granular level, and so they're dynamic in that sense, and they produce a distinct count of children served by the various early care and education programs that are participating in our ECIDS, who's serving them, a distinct count, which order or which sequence, and some program crossover data. Since our ECIDS is new right now, those reports are protected, and our data policy committee comprised of the data sources can approve stakeholders to view those reports. And by joining our ECIDS as part of our data governance, the ECIDS data sources, they all have access to those reports. And in a parallel fashion, we're also building another data product, another data tool, and then that will be public-facing, and that has population data and poverty data, risk factors at birth data, as well as some of our ECIDS data that has been aggregated up to a county or statewide level, and then our data sources are more comfortable with presenting that data at that level to the public. At some point, when all of our data is loaded and validated and our data sources feel confident with what we have, then we may make our standard reports also available to the public. But we're going at the pace that our data sources feel most comfortable with.
Great, thank you. Others on availability of data?
Yeah, so this is Howard here from Texas, and so we have kind of 2 sets. So we have some reports that are available to the internal users that are submitting the data. Most of those are along the lines of data quality checks, but we also allow them to look at some of their pre-kindergarten progress monitoring scores and benchmarks and seeing their growth from beginning of year to end of year. But then we also have external reports that are available to the public. Those are more canned crystal PDF downloadable reports that are available at the state, district, and campus level. Those are looking at pre-kindergarten assessment information, pre-kindergarten enrollment, race, ethnicity, special student population information, and then we have additional kindergarten program and kindergarten readiness reports. So we have a little bit of both, so some that are internal to the users, and then those that are canned external reports that are downloadable for each school district and charter in the state of Texas. But then also there are data downloads that are also available and are aggregated at the regional level as well for our regional education service centers. The data downloads also tend to be helpful for either research institutions, early childhood organizations that are supporting programs within their community without having to do maybe a specific data request or public information request, as that data is readily available to them. It is, of course, masked so they wouldn't have any student level information, but they do have those canned reports. And then we're also working towards more dynamic reports with a newer project that we have, where we're blending the public pre-kindergarten, kindergarten data with our child care quality rating system with the Texas Workforce Commission. And so that'll be more of a select a report and data elements that they want to see for their specific communities. So that's where we're at with our public reports for Texas.
Thank you, Howard.
Yes, if I can add for New Mexico, just really quick on top, we don't have it for the public yet. However, we are required to provide reports as part of our accountability statutes that we have. So, like Texas, we do PDF reports that have some of this information. We're moving right now towards having our data visualization to be with our IBES. That's very interactive. We're doing geocoding so that we can use those maps, those interactive maps, to provide information about where our programs are and what type of services they provide in different types of the community. We're using actually, we're going to be using that information as part of our needs assessment to do the gap analysis. And then we want to have also a more dynamic process, a little bit on the long term, and using the Tableau so that folks can do some canned reporting of aggregated data. So we're not quite there. We are in the collection validation process, but we have the IBES process already set up for doing this data visualization. And then our next step is going to be the Tableau.
Excellent, thank you. So at various stages of this work, and it is good to hear that. Well, Brittany, I'm glad that you found that information helpful. Nikki as well. Thank you for asking the questions. That certainly makes an experience like this more valuable when we can get your direct questions answered by those doing the similar work that you are planning or on doing or engaged in right now. So with that, Steve, Howard, Alejandra, thank you very much. I appreciate you taking the time to address the assembled group and talk about your efforts with your colleagues. Your time is valuable, and we appreciate you taking the time to spend sharing information with us today. So with that, on this slide, you'll see that there are a number of ECIDS resources that are available from a number of different types of organizations. I'd like to just highlight one of them. The DAISY critical questions consist of aspirational questions that are more likely answered with an integrated data system. These questions are geared toward early intervention and preschool special education that can be tweaked to address any program. The Early Childhood Data Collaborative has essential questions and 10 fundamentals of coordinated system, state data systems, the state of early childhood data systems, and relevant and other useful information. So a number of sources there that can be linked to information. So with that, again, thank you for the time, and I will turn it back over to Jim to wrap things up for us.
Great. Thanks, Bill, and thanks, Tony, for pulling together the presentation. And thank you, extra special appreciation, too, to Stephen and Howard and Alejandra for being willing to come on and answer the questions today. I know the information that you shared was much appreciated by the states that were on the call and their partners. and a valuable addition to the conversation. If you do have further questions concerning integrated data systems, we encourage you to either contact your PDG B-5 TA specialist, or free to send us an email at the email address that you see listed there, pdgb5ta@atlasresearch.us. We would love to hear your feedback and suggestions for further communities of conversation, as well as the 4-part series that we completed today. You can link directly to the web address that you see on this slide. It'll take you straight to the SurveyMonkey. We do take your feedback seriously, and we've made some adjustments as we've gone on since we started these conversations. You'll also, everyone that has registered for the conversation today will receive the link to the recording of this conversation, and there will also be a SurveyMonkey link attached to that. So if you don't get to it today, you can always link to it when you receive the recording, and we're very much appreciative of that feedback. I do see a question that came in. We do have a minute or two, and I'm not sure whether Bill or Tony wants to address this. If you don't, we can get to it. The question is the resource, the QRIS and ECIDS webinar. Is it common for ECIDS to be hosted as a portal on a consumer education website?
Boy, Tony, I don't necessarily know. I would think not, but
I'll check into that. I don't think so either, but I can look into that and get an answer.
Sure, Rachel. So thank you for the question, and we'll get back to you directly with an answer to that. Not seeing anything else in the chat box in terms of questions. Thank you all for joining the conversation today. We hope you found it to be a valuable experience. All of the recordings from the 4-part series will be posted onto our website, so you'll have access to this on an archival basis. And the PowerPoints are always available. If you do, again, have further questions, contact your PDG B-5 specialist, and thank you very much. Oh, also, much thanks, I must mention, to my Atlas team that have been working behind the scenes to make sure this all flows very smoothly, and a special shout out to Evelyn and Sammy for managing the Adobe room today. Thanks so much, everybody. Bye.